Welcome back to Physio Matters, this time for a soundbite, an offcut from the recent interview with Matt Phillips and Tom Goom regarding runners. This little snippet is about turf wars between different professions, and just because it didn't make the edit doesn't mean it doesn't deserve broadcasting. So hope you enjoy, and let's see if we can put these petty squabbles behind us. Our full-length interview for session 19 of the Physio Matters podcast is available on iTunes, the Choose Health website, and of course here on YouTube, as well as all decent Android apps. But if you haven't already heard it, here's a little taster. A question that I have to ask you both, because it's been wonderfully fair and balanced, and there's been no fighting or arguing. It's been far too civilized for what I actually like. Yeah, it's a Brighton thing, and it's also because you're both too damn sensible. But if I was to say that there is the most obvious difference that was mentioned at the start is that you've both come from different clinical backgrounds, with Tom as a physiotherapist and Matt as a sports therapist, but both coming to a very similar page, really, in terms of management. Now, that said, that's not necessarily reflected out there, I would argue, and there is somewhat some clinical turf wars that go on with a bit of a tug of war, not just in those two professions, but in others as well. MSK therapists that feel that they've got the answer that others don't. Now, first and foremost, why do you think that might be the case? And also, why is it not amongst the two of you working in the same locality even?
I think this kind of draws attention to the fact that these days it's even more incorrect these days to pigeonhole people according to their career. I mean, the training we do, I haven't done physiotherapy at the university, so I'm not aware of I've got an idea over what the modules involve, but I think most of the training we do doesn't really prepare us for the reality of when we come out. Obviously the university qualification of physiotherapy gives you a lot more insight into the anatomy and prepares you for a lot more case scenarios, but I think any course you do, you only really start learning the day you come out and start working with the people in front of you. So it's how you deal with that that's going to mould you as a therapist, and also it depends what you did before your studies and what you did afterwards, and reading about. I think one of the things that connects myself and Tom is we're both from a running background to start off, which is great because we've experienced what we're talking about. We've both been through injuries, we've both been through the highs and lows, so we've got that to pass on to runners we look after. We're both sensitive to the psychosocial aspects of it, which I think is really important, probably from different reasons as well, because like Tom said, it's from the psychology side of things, of runners helping with their personal mental health and things like that. For me, it's from working from more of a strength and conditioning background where you are making sure that people who are lifting heavy are psychologically prepared to do that, and there's a big difference between lifting 100k in a bench press and ignoring that doubt in your mind, as opposed to lifting 100k and feeling a niggle in your shoulder and thinking I can still do this, I've just got to ignore it. So once you get rid of the whole no pain no gain scenario and start, you can really move forward and start looking after patients better and use the tools you've got. Yeah.
Why is that not, to put it on you as a sports therapist, not that you're a spokesperson for that, but that's not necessarily commonplace across any profession. So would you say, feel free to disagree with that, but is that a common feeling amongst all your peers of the same badge?
In sports therapy?
Yeah.
I don't know. I don't even like saying I'm a sports therapist. I don't know. I don't know what to call myself. I call myself a sports therapist because the last course I did was sports therapy. But before then, I started out as strength and conditioning. I first worked in a gym in 95 or something, back with the YMCA fitness, and then I moved from that into more kind of serious strength and conditioning, and in 2000s I studied with the National Academy of Sports Medicine, so that was very much in the era of when kind of all the Swiss balls and the core fitness and that came through. And in 2003 I wanted to do a bit of massage, and I very much enjoyed a couple of years of just massage to make people feel better and talk to people and probably discuss their strength and conditioning programs whilst they were relaxing, have that hour of kind of intimacy. It's probably the wrong word to use, massage, but just helping that connection with somebody, which I think I'm still a big fan of massage, to be able to do that. If someone's comfortable with you laying your hands on them, then you can get through with a lot of what you're saying, and it's probably often a much more powerful tool than what you're doing with your hands. So from there, then I moved into wanting to help with injuries, and so I looked into the sports therapy and then took myself up to level 5 sports therapy. So yeah, I'm a sports therapist because that's the last thing I did, but there's not another word to use. But at the end of the day, Tom Goom's Tom Goom and I'm Matt Phillips and you're Jack Shue, and it's kind of we can't sell ourselves like that, but how you look after patients is a reflection of your whole life experience and what you've done, rather than the last qualification you did or the one that looks out best on your CV.
Absolutely, I think that's a really nice philosophy, and I don't know if you have anything more to add to that.
Yeah, I totally agree with what Matt's saying, really. I think part of the reason why we can have these sort of turf wars is because there is a bit of blurriness around our roles, and we do share some roles sometimes, and we do sometimes step out of what might be a traditional physio role into something that might be more of a coaching role. And sometimes when we do that, other people can get a bit uncomfortable because it feels like we're encroaching upon what's traditionally been them. But I totally agree with what Matt's saying. Your physio or sports therapist or running coach, sometimes it's just a label. It doesn't necessarily reflect what you know and how well you practice. What I really think, and Matt and I have this, we know each other's work, we've chatted before and stuff, it's about respecting those other health professions and respecting what they know, listening to them, being totally open to learn from them. Because I've learned from Matt, definitely. I've learned from other sports therapists on Twitter, all sorts of other professions. You mentioned Ian Griffiths, his podiatrist stuff's fantastic. If you're prepared to be respectful and open to learning and not defensive and hostile, then you can get so much more out of it. And I think the ultimate thing to aim for, and there's more and more evidence towards this now, is this idea of integrated care, of working together, I mean literally together, getting everyone around the table with the athlete in question, having a cuppa and talking them through how we're going to achieve their goals, and looking at how, what Matt can bring to the table, what I can bring to the table, what you or Ian or any of the other people that we might involve, so that the athlete gets the most out of it, instead of having these disparate people in their little clinic rooms doing things separately. And whenever I've done integrated care stuff, I've learnt so much from it. It's the practical stuff that you just don't necessarily know until you're involved with a podiatrist or a sports therapist or a running coach. It's so valuable. So I think if we can, drop the turf war stuff and be prepared to work together and respect each other, it's going to be much better for everyone.
Just drop the threat and recognise that essentially we're all in it to try and help patients, runners, athletes, and each other.
Yeah.
It's all one big happy family. It's all got rather lovely, hasn't it?
It should be. It
I
should
think
be.
I need
And
a tissue.
sometimes it isn't. And I think there are reasons why it isn't. I mean, part of it is business stuff, isn't it? I mean, if you've got essentially two businesses competing in the same area, that is tough, because it creates that friction that comes with business competition. But that can be separate, and you can still get on and chat and learn from each other. You just have to recognise that there's that thing, that there's always going to be that slight element of competition if you've got a clinic just around the corner that does the same thing as you.
But that can be healthy, it can be ethical, and it needn't be petty. That's the thing.
Athletes, because they have each different people trying to always be as good as possible.
Yeah, and I can admit that it's coincidental that you're from the same geographic area and stuff, but it is interesting that it's not as if you're locking horns on the wall between you being an issue and there's a big disparity, and you're not there to argue that. So that's really refreshing, and something I hope our listeners, and of course anyone beyond that and runners, can recognise that we're there to help them.
We are from a town with an awful lot of runners.
Plenty to go around. Yeah.
Also remembering that Matt is a foot taller than me and qualified in martial arts. So generally, yeah, I think we've got to be safe.
Thanks to Matt Phillips for revealing his identity crisis, and also to Tom Goom for being as balanced as ever. If you haven't already, check out the full episode across iTunes, YouTube, or the Choose Health website. You'll find us on Twitter and Facebook. Be great to hear from you regarding this clip as well as the rest of our content. But we'll speak to you soon.